तो औज़ुबिल्लाहि मिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम. Uh, Today we will discuss, uh, rather we should say we will have a bird's eye view on cataract. As you have learned in your theory lectures and you have done the clinical examination on torch and you have seen how does cataract uh, look like. I will try to uh, uh, gather all these information from the lectures and the clinical uh, examination into some small or in a small talk, so that if you remember now or watch later, so you can recall what is important and what is uh, clinically important and from the patient's point of view, and if you go for general practice. So there will be some recapitulation also, obviously. Cataract is called Sved Motia in Urdu. Cataract is defined as a pacification of the normal crystalline lens of the human eye. And lens has got three parts. One is the capsule, the outermost, the innermost is the nucleus, and the structure between the capsule and the nucleus is the cortex. Lens is like this, a biconvex lens. This is the capsule, outermost. इसके अंदर न्यूक्लियस होता है छोटा सा दरमियान में, और इन दोनों के दरमियान में कोटेक्स और कैप्सूल के कोटेक्स, वो न्यूक्लियस और कैप्सूल के कोटेक्स होता है. So most common cause of cataract is old age. Senile cataract is the most important cause, and it is not a disease. It is just like uh, as our hair gets white with the passage of time, we develop wrinkles on our face with the passage of time. Similarly, the lens is made up of proteins. Uh, they become denaturized, and the clear crystalline lens is converted into opacified lens, which appears to be white in color. There is no medical treatment. No eye drops can help in reversing the cataract. No spectacles. Uh, no spectacles can be used. The only is to take the cataract out and put the intraocular lens. A couple of decades back, intraocular lenses were not invented, and ophthalmologists used to do the intracapsular cataract extraction, in which they took out all the cataract lens, including the posterior capsule. That state is called aphakia. It is very important to remember what is aphakia. Aphakia means lens. A means absent. Absence of lens from its normal anatomical position is called aphakia. This is a very important thing to remember. And related to it is aphakia. What are the signs of aphakia? On torch examination, you must know the signs of aphakia. Signs of aphakia will be when you will show the torch in the eye. The eye chamber will be deep because there is no lens. Okay ना? Logical है. दूसरी बात क्या होगी? Pupil will be jet black. because there will be no shine of the uh, intraocular lens. Third is the tremulous iris. There is no support of the lens from the behind, so the iris, when you will ask the patient to see right or left, and you will see carefully, the iris will be moving like this. This is called tremulous iris. And fourth sign of phakia is the scar of the uh, incision, because when intracapsular cataract extraction was done in routine, an incision of 8 to 10 millimeter was given, and the whole lens cataract was taken out. So these are the four signs of aphakia which you should know, and these are asked in the examination, and otherwise clinically you should also know. And if you go abroad, these questions come also in steps and other sort of things. When bec- lens invention came into being, then the ophthalmologist, what they did, they took out the anterior capsule out. This is the posterior capsule. They removed the anterior capsule. They removed the nucleus from 8 to 10 millimeter incision. ठीक है, मैं आपको सिर्फ उससे ही छोटा छोटा करके सारा बता रहा हूँ, ठीक है। और न्यूक्लियस निकाल देते थे, एंड द रेस्ट cortical matter is somewhat liquefied with the help of two-way cannula, which is also called synco. They remove the intraocular lens and they leave the posterior capsule there. It is the difference between intracapsular and extracapsular. In intracapsular, we also took out the posterior capsule. In extracapsular, we leave it because we have to place the intraocular lens over the posterior capsule. And it is one of the fear of every eye surgeon, and a complication also. If during surgery posterior capsule is ruptured, we cannot place the lens in the eye. So in all the time during surgery, one thing is always in the mind of the eye surgeon, that he has to save the posterior capsule, because lens is to be placed there. Okay. And then, as the incision was given of almost 8 to 10 millimeters, then 5 sutures were applied. Then, after many years, another method, after many trials and many studies, which is the latest method of cataract section, uh, was invented, that is phacoemulsification. Why it was thought that something better should be there? When we were able to put the intraocular lens and the patient could see 6 by 6, then what thought led the ophthalmologists and engineers, biomedical engineers, to think about phacoemulsification? The reason was that in extracapsular cataract extraction, we have to apply at least 5 sutures, and by applying the suture on the cornea and the sclera, incision is given on the limbus, the junction of the cornea and the sclera. When we apply at the end of the surgery 5 sutures, if one suture is tight or one suture is loose, then besides a very good surgery at the end, there would be astigmatism, and patient would not be able to see well. This is one of the causes which led ophthalmologists to do a surgery in which this problem could be eliminated. The other one is the large incision and late rehabilitation. So, phacoemulsification was invented, by which 3.2, only 3.2 millimeter incision as compared to 10 millimeter incision is given, and with a special probe lens is chopped and emulsified and eaten away in easy words inside the eye, and a lens which is almost which was 6.5 millimeter, now it is made 5.5 or 5.25 millimeter, and it is also folded. It becomes less than 3 millimeter, and from that small incision, that folded lens is inserted in the eye, and in the eye it unfolds, and there is no need of suture, there is no astigmatism, and on the very next day, usually the patient is 6 by 6. So this is the latest uh, technique, and now there is uh, in last I would uh, tell you one thing. Phaco is a very hard technique to master, and surgeon has to be very meticulous. This thing produced many complications during the process of learning the Phaco. So again, ophthalmologists and biomedical engineers started thinking about creating something more easier, and they have invented something which is now called uh, femto femto laser cataract, femto cataract laser. All the steps which are done in phacoemulsification manually by the surgeon, they are done by the laser machine. It is the same machine by which we remove the glasses, classic eye surgery. So the capsule axis, you know the steps of phacoemulsification. आपका question भी आया था ना? What are the steps of phacoemulsification? How the you give the incision, capsule axis is done by the machine. Lens is fragmented in small parts by the machine, and you just have to remove uh, these small pieces with two-way cannula and insert the intraocular lens. Rest is all done by the machine. This is the most uh, advanced technique, which is now done in Pakistan uh, at some centers, and routinely it is done in other parts of the world. So here I will stop. Thank you very much.